So I just wanted to outline about the impact of rare diseases on mental health and well-being. I've been working with the European reference networks for the last 6 years now, and EURORDIS have been active for the last 25 years in the rare disease space. And in many ways, the mental health needs of our community have been unseen and neglected, often overshadowed by those other medical complexities. As a community, we're either firefighting, crisis management, trying to get access to a diagnosis treatment, or we're alone and feel quite isolated. And it's when we're alone that psychological impact of the rare disease journey really hits us. We have, as a community, it's best to think about mental health and well-being on two levels. On an individual level, some rare diseases and conditions have an associated mental health comorbidity. But at a population level, actually, the whole of the rare disease community live through the rare disease journey, and there is an increased psychological impact associated with that journey. The search for a diagnosis, that diagnostic odyssey, then getting a diagnosis, living with a condition with poor prognosis. So there's a number of things which actually affect all of us, not just the individual, but the whole family. And when we did a study for the Commission called the Rare Foresight Study, which was looking at where we would be in 2030, our young advocates highlighted that we now need to look beyond the physiological symptoms of rare diseases and take action to address the psychological impact associated with these conditions. So the stresses which are associated with that pathway I mentioned briefly are around that lengthy and can be a traumatic diagnosis journey, where the diagnosis, being given a diagnosis by clinicians, if that's been dealt with in a poor way, where the communication is not family centered, actually that can really impact on the whole of the future pathway. Many people with a rare disease live with uncertainties, and these can be quite multiple. They can be big uncertainties around prognosis and future, but they also can be smaller uncertainties like, oh, I've got my appointment this week at the hospital. Will my test results be okay? Will everyone be there? So those care coordination issues can also lead to higher anxiety as well. There's an association between complex interaction between emotion and physical symptoms, and with lots of conditions, there's a high logistical burden in terms of coordination and case management of all the services which are needed, which can be left to the family to deal with themselves. And all this can add to the strains and stresses on family life. We've looked at the evidence base, and we've been a Genetic Alliance UK survey highlighted that 90% of people living with the rare disease who were surveyed felt worried, anxious, or stressed, or depressed. And actually 19 had suicidal thoughts, which is an uncomfortable figure we need to address. That a third of parents of a child with an undiagnosed disease actually meet a clinical criteria for mild or moderate depression or anxiety. And that 1 in 7 carers and patients must reduce or stop their professional work to coordinate their own care and to try and make sure that they get the care they need. And that really impacts on financial income, around living independently, and future prospects. But there's a number of factors. When we did a workshop in Stockholm this year with our members, and Klaas was very kind and came and presented at that, we also identified a number of things called protective factors, which as a community we built up ourselves to mitigate these stresses and anxieties associated with the journey. And that can be some of the protection factors is when your physical health symptoms are better managed, actually that has a positive impact on mental health. Being included in communication, involved in your own care, can enhance a feeling of well-being. Family-focused care protects relationships. And there's a number of coping strategies which are employed by having peer-to-peer support, like in NF Patients United, or getting support via social media, are key tools really which our community leverages. We were told that being connected into a community is transformative. It helps format a self-identity and reduce isolation and stigma. And becoming an advocate actually is quite an empowering process, because it's a way to take control of the situation when uncertainties, to manage some of those uncertainties which you face. And some other aspects are really around self-care and development. Setting yourself bigger goals to reach can build confidence and resilience. And learning really to move from not just fighting a condition, but learning to live a life as well, and not let the condition dominate. Getting to that balance is really important. So why are we looking at mental health and well-being now as a community? Well, at a global level, the UN General Assembly recognised this need for rare diseases, and they urged member states in their recent resolution to develop psychosocial support for people with a rare disease and to promote policies and programs to enhance well-being of families and caregivers. The WHO recognised people with an existing health condition, chronic conditions and rare diseases as being disproportionately affected by COVID measures, the pandemic, and the isolation which came with that, and the social distancing. And at a European level, we had also, on the back of COVID, or the hangover from COVID, was a real impact on mental health and well-being of the general population, really, overall. And this led to Ursula von der Leyen, the Commission President, highlighting that mental health was a priority for them. And they've published a new communication this June to address the public health priority around mental health. EURORDIS are representing the rare disease communities, building on the WHO to ensure that people with rare disease are seen as a community in a very vulnerable situation. The new communication has 1.2 billion. Sounds a lot, but it was already allocated funding. But there is a number of priorities and flagship initiatives. And one of the priorities is to address and help those most in need, which includes people with chronic conditions, multiple comorbidities, cancer or risk of cancer, young people and children. So there's a number of needs which actually our community live with. So what are we doing? We looked at our Rare Barometer Voices survey results, and indeed this confirmed the evidence which we've seen that people with the rare disease are 3 times more likely to be unhappy or depressed than the general population. And that whilst overall the community is very satisfied about the physical care needs, physical care they access in their specialist centres, actually they highlighted that the psychological and emotional side isn't supported. So there's this real lack of a holistic approach which is being seen. This is all our action. I won't go into detail that we've been taking since we've prioritised prioritize mental health in EURORDIS. We've been working to represent the rare disease community to ensure our needs are recognised in this new communication by the Commission, and we're leading to a policy event at the European Parliament in November this year. And actually, Klaas, I have to give him a shout out. He's been such a champion for the rare disease community in supporting us take action at a European level. So thank you very much, Klaas. And he will be a speaker at this parliamentary event. So EURORDIS are taking action as a community as well, not just advocating with the European Commission. And because, in a way, the mental health needs of our community have been neglected for so long, it's time now to give space in our community to come together and to say your mental health and well-being matters. And so we're setting up a new network. It's called EURORDIS' Mental Health and Wellbeing Partnership Network. It's a partnership network because yes, it's a patient community are there, but we want to work in partnership with the clinicians and researchers and psychologists in this space. So the network is there to support and reinforce a united and empowered rare disease community affected by mental health and wellbeing to come together, to be seen, to learn, to advocate and support each other. We have over 100 members already. If you're interested in taking part, you're more than welcome. I'll show you how in a second. We've got 12 European reference networks connected into this new network as well. And as you can see, ERA and Gentoris are there, top of the list. We have the network covers 26 countries so far, inside the EU and also outside. We've got 40 clinicians, researchers and medical experts, and 60 experts by experience. We've got a whole program of work set up under 5 pillars. I won't go into detail, but some of the activities we'll be doing over the next 12 months will be to look at some of the identify needs of our community in this area. It could be looking at some common issues or challenges like living with a disability and how that impacts on mental health and well-being, or looking at how multiple intersectional needs can impact on mental health and well-being. We're doing some work under a research and quality of life group to try and identify some of those common symptoms, which maybe if we built the evidence base up for, could help strengthen publications like the new NF1 tumor management guideline by bringing into one space the evidence base for that. We've got a new website, a web page on mental health and wellbeing. And if you're interested in taking part in our new partnership network, you can just click at the bottom here and you'll be able to join. Last slide, really, and it's just to say a big thank you. You know, one of our advocacy aims under the new partnership network is to make visible rare diseases in the mental health space. Lots of advocacy communities are very separate, you know, disability over there, mental health over there, and here's rare diseases. And we want to step into the mental health space and make rare diseases more visible. And EURORDIS joined Mental Health Europe, which is an NGO representing mental health with the Commission, very active group. And they invited us, Mental Health Europe invited us to do a blog, and actually Klaas very kindly agreed to do that blog, which can highlight the impact of NF1 on mental health and well-being of the individual and the family. So this is available and live now on the website. So again, thank you to Klaas for your unwavering support. Thank you.